Okay, we talked a lot about intestinal permeability, and we'll give you a couple of reminders today, but intestinal permeability, in my opinion, is a big time causative factor of autoimmunity. Disruption of the epithelial barrier, we need to have good epithelial barrier function, right? That's what basically helps to keep out what's not us and making sure that it stays in the intestinal tract to eventually be eliminated versus ending up in the bloodstream where we don't want it to be, right? So the mucosal barrier does consist of not only of these epithelial cells and the tight junctions in between those cells, but we also talked about this concept of mucin and mucus and other types of antimicrobial peptides. IgA, secretory IgA, which is secreted by the goblet cells, the Paneth cells, and the plasma cells. So this secretory IgA is extremely important as one of our first lines of defense against bad bugs and other types of harmful agents. So again, these effector molecules, they all constitute a barrier between the inside and, of course, what's going on the other side, which is the bloodstream. So when we have intestinal permeability, otherwise known as leaky gut, that's when we end up with issues. So clinical reports have suggested that leaky gut initiates inflammatory responses in the intestine, and then, of course, in extraintestinal tissue as things move from the intestine to systemic immune activation from there, and has contributed to many different types of autoimmune problems like type 1 diabetes and MS, rheumatoid arthritis, celiac disease, and many more. So here's a great picture here kind of showing the progression of things over time. Here again, we have our epithelial cells with our villi that are sweeping and absorbing nutrients properly. In between, these little band-aid things are tight junctions that exist between the cells that prevent the flow of large molecules and particles of food in between the cells. And then, of course, here we have our two layers of mucus. We have our inner mucosal layer and our outer mucosal layer where the good bacteria hang out. And eventually, over time, whatever's going on, we have genetic factors and other types of environmental factors that degrade the mucosal layer. Here, now we've got a large hole in our mucosal layer. And now, of course, we've got our epithelial cells that have become impacted. They're not as healthy, and we lose our tight junction between those cells. And now we can have the translocation of these bacteria from one side, from the lumen into the bloodstream. And here we have the activation of our immune system, just as we talked about a bunch of times already, where we have our pro-inflammatory cytokines that are released by our macrophages and dendritic cells those are our antigen-presenting cells. They're the things that start the entire cascade. But it's this erosion of our mucosal layer, the disruption of our endothelial cells, and eventually the tight junctions going away as well that become unzipped that cause this whole thing to start. And then, of course, we have down the line, we've got more and more epithelial barrier dysfunction, and then leaky gut persists. And unfortunately, down the line, autoimmunity can happen as well. Let's talk about some strategies for helping to repair the intestinal lining. One of the main ones that I use in my practice is NAG. That's not NAC. This is N-acetyl glucosamine. But we have these things called glycosaminoglycans, otherwise known as GAGs, which make up part of the protective mucus layer and truly are essential to functional intestinal barrier function, is what I really wanted to say. For example, the mucin layer in patients with active IBD is much thinner compared to healthy controls, and it has fewer complex GAGs attaching to them. So we need these GAGs as part of this whole mucus layer that we just talked about to keep things protected. And so N-acetylglucosamine, otherwise known as NAG, is a naturally occurring amino sugar. It can be used as a precursor for epithelial glycosaminoglycan synthesis. So if we take this exogenously, it can help to produce those healthy GAGs and start to make up some of that mucin layer that we need. Compared to other GAGs, other precursors, such as glucosamine sulfate, NAG has been shown to be 10 to 20 times more preferentially incorporated into this mucin layer. So I think it's a rock star, especially when it comes to helping to rebuild the mucosal layer of the intestines. NAG has also been shown to support the growth of Bifidobacteria, a type of gut protective bacteria that's often taken in our probiotics. So it can be very helpful to start to repair the microbiome, which oftentimes is damaged and is a causative factor in intestinal permeability, and intestinal permeability can cause dysbiosis. So NAG can be helpful to start to create some more Bifidobacteria. Let's look at a few studies of NAG here. This is a study of rats. This is with IBS, but nonetheless, what I really wanted to show here is that when the rats were given NAG, the microscopic structure of their intestinal mucosal became normal. And that's really amazing. So these rats were basically subjected to leaky gut. The researchers made them have leaky gut, and then they reversed it by giving them NAG. So that's a pretty cool rat study. This was a human study here. This was 34 adult IBD patients with autoimmunity. This is an open label clinical trial. They were given a daily dose of 6 grams of NAG, which is a pretty hefty dose, taken orally for 4 weeks. They had self-reported IBD symptom scores assessed at baseline and after 4 weeks of treatment. 88% of patients reported that NAG was helpful with their IBD symptoms. Close to 60% of patients reported improvement in their abdominal pain, almost 50% reduction in symptom score, and 65% of patients reported improvement in diarrhea and 47% reduction in symptom score here. They also had significant reductions in symptom score observed for nausea, passage of mucus, and rectal bleeding. This is again in patients with IBD. That's huge. And again, just one nutrient, again, I would say 6 grams is a pretty hefty dose, but depending upon the severity of the case, it might need to go that high. The other thing that NAG might have a role in is helping to regulate the immune system. It can also potentially shift things in a good direction. It can help to promote anti-inflammatory Treg cells over the pro-inflammatory Th17 cells. Remember, we want those Treg cells to be able to move things in a good direction and be able to shift that seesaw in an appropriate direction where we don't have a dominance of either Th1 or Th2, and then also being able to inhibit those Th17 cells. So pretty cool. So this is all using NAG. So NAG, I would say, needs to be as part of your protocol for helping to heal the intestinal barrier, whether it be in patients with autoimmunity or patients with leaky gut. So I think that's important. Glutamine is another nutrient that I think is very important. The gastrointestinal tract, you guys may not know this, is by far the greatest user of glutamine in the body, as the enterocytes, those are the cells of the small intestine, in the intestinal epithelium, use glutamine as their principal metabolic fuel. So the enterocytes absorb glutamine from the lumen of the gut as well as from the bloodstream. So due to its multiple roles in the GI tract, glutamine demand in the mucosa is more than 15 grams per day, 15 grams of glutamine per day, which can be obtained from the systemic circulation, as there's very little glutamine synthase activity in the mucosa itself. So this is where we're going to get this from the systemic circulation, and it's going to come and we're going to bathe those enterocytes, and they're going to be able to use that glutamine as fuel. Pretty awesome. Bodily stores of glutamine can be overwhelmed by catabolic conditions. Those are the conditions that break down the body, including injury, burns, surgery, overtraining, or cancer. And if, for example, prolonged exhaustive exercise leads to a nearly 25% drop in plasma glutamine levels, and this can contribute to mucosal atrophy. And oftentimes we see people who are overtrained, oddly enough, interesting enough, actually, who end up with leaky gut, right? That's basically what's going on. We damage the mucosal layer and oftentimes end up with immune issues as well. So training is great, and I'm a gigantic proponent of exercise, do it almost every day, but overtraining certainly can cause problems with the gut. And we see this a lot, and I've seen it quite often in my practice over the years. Another instance that is extremely catabolic in nature is many forms of cancer, especially advanced forms of cancer. And I use glutamine a lot to help to protect the gut as much as possible in these individuals. It also helps to replenish muscle amino acid pool, and it can be very helpful to offset some of the reactions of chemotherapy in patients who are undergoing chemo. So most of the research on glutamine and its connection to intestinal permeability has been conducted in conjunction with the use of TPN, that's total parenteral nutrition. This is where we're giving nutrition intravenously for patients who are not able to eat. Commercially available TPN solutions actually don't contain glutamine. And what has been shown is that can cause small intestinal mucosal villus atrophy. So we need the glutamine to be able to support the enterocytes and those amazing villi that help to absorb your nutrients. Glutamine supplementation does cause a profound improvement in intestinal barrier function in highly stressed patients and patients who are receiving TPN. When glutamine is fortified in the parenteral nutrition, both N enteral diets, those are the diets that are by mouth, it does significantly improve the intestinal morphology and function. So glutamine in and of itself is extremely beneficial to helping to repair the intestinal mucosa. Clinical and animal studies have demonstrated that the administration of glutamine before or immediately after surgery reduced the intensity of the increase in intestinal permeability and systemic inflammatory response. So any patients who are going to be undergoing surgery, especially severe surgeries, I would highly be recommending glutamine. Numerous clinical trials in humans demonstrate that even at high dosages, glutamine administrations without many side effects, it's well tolerated, even during times of physiological stress. It's usually administered orally in bulk powder form or in encapsulated form. The dosages vary greatly depending upon whatever clinical situation that you're trying to help, but usually it's in the range of 2 to 4 grams daily in divided dosages for just generalized intestinal support. For critically ill individuals, people who have cancer or HIV, the dosage is much higher, usually from 10 to 40 grams per day in divided dosages. So for these patients, obviously they can't be taking 1,000 capsules a day. So usually the bulk powder form is the best way to get it into the body. And usually we do mix it in with smoothies and things like that to help them be able to take in all this powder all at the same time. All right, so NAG, glutamine, and the last thing we'll talk about here for intestinal repair is mucoprotection. Mucoprotection, I can't say enough about the healthy mucus, as we've talked about a bunch of times. If you learned nothing else from this talk today, hopefully you remember you need the healthy layer of mucus in your intestines to help keep your immune system active and healthy. Okay, so here we have our small intestine on the left, here we have our colon over here on the right. We have our mucus layer here with our secretory IgA that's floating around in it. And it's produced by some of these things like our pan cells and other types of cells. Here we have our colon with 2 layers of mucus, our inner layer and our outer layer. And the outer layer is where a lot of our healthy bacteria hang out. They're there to protect your colonocytes and the layer of your colon. So what are mucoprotectants? Mucoprotectants, the mucus layer becomes damaged, right? And so what we want to do is we want to be able to put a dome of mucus back around this intestine layer so it can heal itself. So mucoprotectants provide this protective film over the intestinal mucosa and are one way to reduce intestinal permeability and improve the function of the intestinal barrier. You know, sometimes it's very, very hard to repair when they have continual insults. So I really like herbs that are known to be demulcent. These demulcents are kind of like slippery in nature. They're kind of mucilaginous in nature. They have a high concentration of mucopolysaccharides, which provide mucoprotection. So 3 that I've used in my practice, usually as a combination, sometimes as a standalone, depending upon who the patient is, are slippery elm bark, marshmallow, that's not marshmallow that you get at the grocery store that you roast over a fire with, with s'mores, and then aloe vera juice can also be very, very helpful. All 3 of these have known to be demulcent in nature and can be very slippery and protect this mucosal layer and intestinal barrier. I'm not going to give any specific recommendations on dosage here, but because it's going to vary from patient to patient, but you can tinker around with those 3 demulcent herbs and there's a variety of ways that you can get those into the body as well. So I really like those 3 herbs for mucoprotection.